All right, so we're looking at some of the muscles that comprise and hold the shoulder in place. Here's your pectoralis major, your deltoid. This is your clavicular head. Now this is kind of sheer because you can kind of see through it. But when you're drawing blood, take a look at this. You see the blue vein? Do you see the blue vein? That's what you're drawing from. You're drawing from this blue vein. And how does it run? It runs under the clavicle. It's medial to the brachial plexus nerves and the subclavian artery, isn't it? So it kind of sits in the middle of the two. It runs the length of the humerus, which is this bone right here. And here's a little bit more of a close-up. All right, so you see everything coming underneath the clavicle. So when someone has a rotator cuff injury or a muscle injury in the shoulder area, you do a cutaway, you can see that the deltoid is really, quite meaty. They're quite thick. They're all striated, long muscle fibers that kind of interweave in between each other. Most of these are extrinsic muscles. And fed by the anterior rami. And so you see the deltoid. Now, some people, when you're drawing their blood, you may not even think that they may have wrist drop, right? Or like a claw hand, which is from an ulnar nerve injury. And wrist drop, comes from a radial. It's in the radial is injured, but it's like the radial the radial nerve, I want to say, is injured, and people with carpal tunnel that have numbness and burning and pain in their hand. Yes, you don't have to ask, Miss Yasmin. And then, of course, when you have shoulder injuries, you have the Herb Duchenne, which is the waiter's tip, where the arm rotates medially and inward, and their hand comes back, like someone's trying to reach for money from behind. That type of paralysis can come from a shoulder injury where the neck and the head there's a huge stress on the muscles and they separate. And it prevents the lateral rotation and abduction, or I should say abduction or taking the arm outward. So you have to be aware of these types of problems when you're drawing blood on people. You can't just say, oh, I've got a vein. Is their hand? You can't get blood from a paralyzed hand. You know that, right? If the arm is paralyzed, that means the blood flow has been impeded. So if someone's hand is paralyzed or is extremely weak, it's going to weaken the blood flow, and you're going to be lucky if you get half a tube of blood. And these are things you have to think about. If someone's blood pressure is low, their blood flow is going to be not so great, and you may not get a whole tube of blood. So these are, if you don't know about these, then you wouldn't be able, you'd probably wonder, how come I can never get blood from this patient? Well, they're always hypotensive. Their blood pressure is always low. Or they may have some type of nerve damage in their arm. With nerve damage, eventually the muscle will atrophy. And atrophy means what? Lack of use causes deterioration of the muscle, right? So one muscle is going to become smaller than the other muscle. And as that happens, they're not going to have that much strength. So combine that with poor blood flow, that's probably not the optimal arm to try to draw blood from. Does that make sense? These are things that you have to critically think about.
When they go in there, Obama's go in there and draw blood, they don't do the blood pressure, right?
No.
So how do they know if they got low blood pressure if the nurse ain't been in there?
Well, they won't. You won't know that if their blood pressure is low. But a couple of things. If the person's kind of weak and you're coming in at 10 o'clock to draw their blood and they're in a hospital, rest assured they've had their medication. And if they haven't drank enough fluids, they're probably hypotensive, particularly if they're older.
So should they ask, like the nurse, what was their
You
blood
know,
pressure?
that's not, even if you know their blood pressure is low, you're still going to have to take the necessary steps to try to get their blood, which would be what? Gravity, right? If you allow their arm to, sit by their side with the tourniquet on, for 35 seconds or 50 seconds or so, that will allow the blood flow to build up. Also, if you put a warm compress or warm washcloth on their antecubital fossa while the arm is in the downward facing position or lateral to their axial skeleton, a warm compress will bring the veins out as well.
Okay, so it's still a way to get.
Yes, yes, but you also have to be sure that if one arm has more strength than the other, right? Because the stronger the arm, the greater the blood flow. The weaker the arm, the weaker the blood flow. But you would never draw on an arm that's paralyzed or in contracture.
Like if a person had a stroke, you can't draw from that side.
Never. Never. No. It's not the same. The blood flow is not the same in a contractured limb, right? Or paralyzed limb. Now, when the deltoid is injured, okay, and you have that Herb Duchenne palsy or waiter's tip medial rotation of the arm itself, some of the other muscles will take over and cause the medial rotation. The trapezius will actually pull the arm inward because the arm hasn't the strength to go either direction. So here we go. Now we're getting into what? Some of the veins that we know. So if this is the subclavian, right? Subclavian vein. Oh, look what happens. It goes from subclavian vein to what? Axillary vein. Yeah. And then the axillary vein kind of branches off the subclavian vein. Here we go. And as the axillary vein branches off the subclavian vein, we get cephalic, which is what? Medial or lateral on the arm. Think about it. What are your positions? This is the anatomical plane with my hands facing you. Where is the cephalic? Lateral. It is lateral, right? On the outside, out this way, right? The basilic branch, the basilic and the paired brachial veins branch off what? The subclavian, right? So I would imagine that the median cubital also is branching off the subclavian vein, as you can see these branches right here. I don't know how well you can see that up there. Okay, so very cool. Let's continue. Again, arteries go away from the heart, veins go to the heart. So if veins are going to the heart, and you're standing like this, right? Veins are going to the heart. So when you stand in front of someone to draw their blood, okay, think about it for a second. Veins are going toward the heart, and you're standing facing that person. Their arm is outward stretched to you. You're catching that blood, aren't you? You're kind of catching that blood. You put in the vacutainer, it sucks in the blood. So here you go. This kind of makes you see this. Okay, so here's the manubrium. Got the angle of Lewis. You've got your xiphoid process. When we teach CPR, we try to tell students to stay above this little xiphoid process here, because if you're too low on the sternum, you can crack this off and it can puncture the liver. So try to stay up on the sternal area between the breasts. How many of you have CPR training in this class? I would strongly suggest to all of you that do not, call the American Red Cross or American Heart Association and take a class in CPR. It's going to help you with your opportunities in looking for work, okay? It really will. Okay, so costal cartilage. All right, let's continue. And before we get into the heart, you can kind of see how this is going. This is your aortic arch. And you have the 4 vessels coming off the aortic arch, which is the right and left carotids and the right and left subclavian arteries. Okay. And we're going to look at the heart just shortly. Okay, so we're getting into some of the branches, and now we're in the arteries. So the arteries run deep, don't they? But what do you notice about this artery? It not only runs deep, but it runs, okay, not so much, well, medial, right? Medial to the axial skeleton. Deep and medial. Okay, these are some of the muscles that cover the scapula. And as you can see, this is your scapula. This is your supraspinatus and your infraspinatus. And if we're looking at this, let's see, subscapular nerve. Are we looking at someone who's facing us or someone who's facing away from us? Look at this for a second. Here's your acromion process. Is this person facing, are we looking at them dorsally? Are we looking at them laterally? Or are we looking at them anteriorly? Right, so look, okay, so here's what I would say. When you do a shot, when you're giving a shot, an intramuscular injection in the deltoid, we look for the acromion process, and then we come down to find the deltoid muscle, right? So if I were to give a shot to this person, I would feel for the acromion process, and then I would come down to find the deltoid muscle. So if this is the acromion process where the scapula articulates, when the clavicle articulates with the scapula, and this is the arm, then this has got to be the spine, right? This has got to be the spinous process of what? Of your scapula, right? So basically, you're looking at that person from what? Behind, dorsally. So rotunda, you'd be right. Do you see that? It gets kind of crazy, right? When you're just looking at bones and things like that and muscles to determine. But where's the arm? Here's the arm. Right?
What is that bone at the top? What made me?
Right here.
Yeah.
This is part of the scapula. This is the superior arch of the scapula. You can feel that.
That's only in the back, right?
Yeah.
That's how I knew.
You were right. You were absolutely right. Army over Navy. I don't know what that refers to, but I like it. It's good. Okay, so here we go. Here comes your major arteries, right? Here's your subclavian running underneath the muscles, underneath the clavicle, in the axillary area. Okay. So when you take a look at the beauty of God's design of all of this veins and arteries and muscles and things like that, and you think, we're just going to draw a little tube of blood, just going to go in the vein, hit the vein, draw a little tube of blood. It's way more than that, isn't it? On the inside, right? Lots going on in the inside. Absolutely. So here's your muscles. So here we are All right. Looking at, again, the dorsal part of the human being, right? Because here's what? Here's our clavicle, right? This is the front. So this is coming around. This is the deltoid. So your triangular space. The triceps brachii. This right here, the olecranon, is where your elbow is. This helps me see the back because this is where it attaches to the ulna bone. Okay, and then back here, 29 out of 29. Alrighty, we are good, folks.